Doctors are simply amazing. You know, how they save lives by doing complex surgeries. But in Boston, some doctors did something extraordinary. They performed brain surgery on a baby still in its mom's belly. Yeah, you heard it right, before the baby was born.
The first brain surgery performed on a baby while still in the womb.
This story is worth more than you think. So let's get into it. Back on May 4, 2023, a team of Boston doctors surprised the world. They attempted a surgery that was so rare no one thought it was possible. They performed brain surgery on a baby who was still in the womb of its mother. This was the first time anyone had done this, and the results will have you amazed. So what exactly happened? How did the doctors know the unborn baby needed surgery? And did it affect the mom carrying the baby? We'll explain everything in detail. Keep watching. Ultrasound detected brain damage in the unborn baby. Derek and Kenyatta are a regular couple from Louisiana who got a big surprise when they learned they were going to have their fourth baby. After 7 years of marriage, they were thrilled about this new addition to their family. Everything seemed normal during the pregnancy, and they had no trouble getting pregnant. Being experienced parents with 3 kids already, they thought they knew what to expect. However, something unexpected happened that left them in shock. The mom, Kenyatta, felt like her pregnancy was just like the others. They had routine ultrasounds and everything seemed fine. The early ultrasound reports showed a healthy baby growing in her womb. There were no signs of trouble, at least not yet. All the tests, including genetic testing, indicated a low risk for any issues. Despite thinking everything was going well, fate had a different plan for them. Around the 30th week of pregnancy, Derek took Kenyatta for another ultrasound. The results of this ultrasound was devastating for the couple, and even the doctor delivering the news was concerned. The doctor explained that their baby was not developing a healthy brain, and the heart was abnormally enlarged. The chances of the baby surviving or living a severely disabled life were high. The parents were left with a difficult decision: either terminate the pregnancy or let it continue, knowing the challenges ahead. So what did they decide? How did the doctors assist them? And what happened to this innocent baby who's still a stranger to the world outside the mother's womb? Parents faced a very difficult choice. Most of the doctors and relatives suggested that the couple aborted this pregnancy. After all, it would be cruel to bring a deformed baby into this world who had to depend on others' mercy all its life. But Kenyatta had carried the baby so far in her womb, she was a mother, and a good one at that. She could not accept the idea of aborting her baby without putting up a good fight. The doctors even told her the risk of pregnancy, as it could be fatal to her as well. But for her unborn baby, Kenyatta was ready to fight the death itself as well. Her husband supported her decision to fight and find a way out of this difficult situation. They worked together and searched for a way to help their unborn baby and make their lives more normal. They did a lot of research and learned about something called utero surgeries. These are surgeries done on babies still inside their mom's belly. Usually, these surgeries fix small problems with things like hands or feet. But there was a problem for Kenyatta and Derek. Their baby had trouble developing a brain. Even though it was a tough situation, they didn't give up. They studied uterus surgeries, talked to doctors, and did more scans to understand their baby's condition better. They were determined to find a solution and give their baby the best chance for a healthy life. More checkups showed that their soon-to-be-born baby had a rare brain problem called vein of Galen malformation. This happens when the blood vessel known as the vein of Galen that carries blood from the brain to the heart doesn't grow right. Too much blood stressing the vein and heart causes lots of health issues. Babies with this problem can get big brain injuries and might have heart problems right after they're born. It's also risky for the mom to keep the pregnancy with this issue. Now that Kenyatta and Derek knew what was wrong with their baby, they were ready to try their best. They really wanted their baby to live and be healthy, just like their other kids. It was a tough situation, but their love and determination made them work hard to find a way to help their precious little one. The parents learned that a hospital could provide right treatment. There was a special trial happening at hospitals in Boston that might help their baby before it was born. Since waiting until after the baby was born wouldn't work, they had to do the treatment before birth. It was a tough decision because the procedure was complicated and regular brain surgeries don't always work well. Doing brain surgeries on a baby inside the belly wasn't the best situation, but it was the only choice Kenyatta and Derek had. aside from deciding not to continue with the pregnancy. So they decided to join the trial. On March 15, exactly 1 month after the ultrasound found the problem, Kenyatta had the surgery. It was a very risky one. Both the baby and the mom could either survive or they both might not make it. The doctors were ready to do something never done before: brain surgery on a baby still inside the belly. If it worked, it would be a historic moment in medical history, and the parents could hope for their baby to grow up normally. So they went through with the surgery with high hopes. But what happened next? The surgery had 2 patients, Kenyatta and her fetus. Because the baby was inside Kenyatta, he was the one having the surgery. The doctors used ultrasound to perform it. It was a very complicated, rare, and kind of scary choice for both the mom and the baby. But because the parents and doctors hoped it would work, they decided to ignore the risks. When the doctors started the surgery, they made sure the baby was in the right position, with its head facing Kenyatta's belly. Dr. Louise Wilkins Hogg, who was in charge of the surgery, is a special doctor at Brigham and Women's Hospital. She's the boss of the Maternal Fetal Medicine and Reproductive Genetics Division. She knew she had 2 lives in her hands, and she was ready to do her best to save both the mom and the baby from a tough situation. Dr. Louise Wilkins Hogg worked together with Dr. Orbich to make sure the baby was not only in the right position for the procedure, but stayed there. This was crucial for the success of the surgery. She wanted the baby to be in the best possible condition for it. Without the baby in the right position, the constant movements could mess up the procedure and put the mom's life at risk. So Dr. Wilkins Hogg gave a small injection to stop the baby from moving and another one for pain relief. Figuring out the right amount of medicine was tricky because too much could lead to immediate heart failure. After the medicine, the doctors got the signal to continue with the surgery. They put a needle through the belly, carefully passing a catheter through it. This allowed tiny metal coils to fill up the vein, slowing down the blood flow and reducing the pressure. And happily, the baby started showing signs of getting better right away. Now the blood was flowing well to the baby's brain, and only important areas had lower blood pressure. But this good moment alone couldn't guarantee the overall success of the surgery. There was still a high chance that the baby might not grow healthy and could face brain problems again. It's quite common for a baby to go back to underdevelopment as the pregnancy continues. Anyway, the doctors finished the surgery and it was successful. But now, time had to show if it would stay that way. Would the baby need more help? Could the baby face heart problems right after being born? What happened next? Further ultrasound reports showed that the fetus was a girl. When the couple found out that they were having a baby girl, they felt a strong sense of hope. They believed that their daughter could be a fighter, just like her mom. The parents and doctors had done everything they could to help, but now the real fight was for this unborn baby girl. She had to keep going on her own. 2 days after the surgery, Kenyatta went into labor. The baby was now 34 weeks old. It was a very important day for the couple and the doctors. They prayed and hoped for a regular delivery and a healthy baby. It seemed like their prayers were answered because the couple welcomed a beautiful baby girl named Denver Coleman. Denver was born weighing 4 pounds and 1 ounce. For Kenyatta, the sound of her baby girl's cries brought tears of joy. It was the happiest day of her life. She had taken a big risk to give her baby girl a chance at a normal, healthy life, and her little one had fought for it too. Even the doctors were moved to tears hearing the baby's cries for the first time. It felt like a miracle, a new life given. Derek shared the wonder of holding his little fighter, his baby girl, and hearing her cry. Denver was born stable and didn't need the immediate treatments that babies with brain damage typically require, like placing coils or supporting heart function with medications. As a precaution, the doctors kept a close eye on Denver for 2 months after her birth. To their surprise and joy, she continued to thrive, spending her time eating and sleeping like any other normal baby. Her neurological exams were all normal, and she didn't need any medications for heart failure. No extra help was needed from the doctors, and it was a happy ending to a challenging journey. This story about doctors fixing a baby's brain before it was born is really amazing. It's one of the best stories about someone staying strong and getting better. If you like the story, please share the video and leave good messages for Denver in the comments.